Well, I think a lot of us know Chuck from his years at Healthcare for All Washington. Weren't you the president of that organization and on the board for like 6 or 8 years?
Yep.
As I recall, a school teacher for your most of your working life.
40 years, college, high school, junior high. Junior high was the hardest.
We had a board retreat at PNHP last Saturday, and we asked Chuck to come and facilitate the meeting for us and to put together a report afterwards. So he is invited to join us tonight to present a report that makes some sense out of what we said on Saturday. Good luck, Chuck.
I think it won't be difficult. You guys did a lot of good work Saturday afternoon. I'd like to begin by saying thank you for the invitation, both to facilitate last weekend or tonight. Both my work in Healthcare for All and PNHP, working with you all and getting to know many of you have been great years for me. I've learned a lot. Also, you gave me the great honor of being a recipient of the John Geyman Award several years back. And my daughter still sees the certificate over in the corner and says, "Dad, what's this all about?" So I've always felt very honored by that. Thank you. So what we could do is go in. I think the procedure, we talked about, David and Sherry and I would give a report on the slides that David's prepared, came from our notes from the meeting. And I think I feel it'd be best if I went through and did the slides, so to speak. And then we stop and have questions on any slides. And David volunteered to go back and run the slides again if it helps you remember your question. But do feel free to write it down as we go. And maybe with that, we'll start. Great. Well, it was great working with the PNHP board, PNHP Washington board last weekend. And what was really helpful was that the national PNHP had just had their own board meeting weeks earlier. And so we were able to use their recommendations and their observations on what Congress was trying to do to try to be up to date. So we're offering you, I think, some of the most up-to-date information there is on our issues on single payer universal healthcare. So here we go. So as you know, one can check on bills at any time by going to www.congress.gov. And if you do that, you will see that our two bills, Medicare for All Act by Pramila Jayapal, is still alive. It's got its new number, and it has 116 out of, 435 members of Congress have signed on. Besides Pramila, our only other representative is Adam Smith. So that gives us, as always, plenty of work to do with the rest of our representatives around the state. The other bill that you may have heard about is 3775, which is the bill providing support for state-based universal health care. This is the bill that would provide crucial federal funding if Washington state ever got around to passing our own universal health care bill. There's a lot of work is being, as you know, done on that all the time. And there's a commission being appointed even as we speak in the next 2 months. Sherry could answer more questions on that later. Again, note, on either bill, only Pramila Jayapal and Adam Smith have signed on to both. None of the others yet have, so there's work to be done. So let's talk about this Congress. Dave, next slide. We hear from the PNHP meeting, July 8th, that the Democratic majority leadership and the president have decided that to tuck inside the American Family Plan, a big omnibus spending bill, to do a lot of infrastructure and providing family benefits that a lot of people are desperate for. They have decided to try to put in these 4 items. Reducing the eligibility to age 60, they figured is probably the most difficult thing to argue for budget-wise, not because it's important. And but all of these are up in the air now. Nothing has been said in concrete. Therefore, this is a great time to get a hold of members of Congress, because it's all in the talking and nothing has been written out yet at all. Nothing is definite. PNHP wanted to remind everybody who just wanted to work on Pramila Jayapal's bill and maybe Bernie Sanders' bill, is that while we're waiting for universal health care, it's been noticed, I'm doing the second bullet point down here, year by year, if nothing's done to improve the traditional Medicare, people are slowly being pulled into, sucked into, designed into Medicare Advantage. And the percent of people under Medicare Advantage is growing. So it's time to be actively trying to improve, to strengthen traditional Medicare. And the way to do that is to always make sure we talk to our members of Congress. We don't want to try to give money, put additional money into Medicare Advantage. Let's go to the next slide. We'll start with the Senate. This is a list of the committees our 2 senators are on, and each of these committees has a voice on this American Families Plan, and which includes these 4 provisions that we hope all are in strengthening traditional Medicare. But so Senator Murray is involved in a subcommittee on appropriations, so she can't say it's not her issue. And she's also the chair of that committee that is sometimes called the HELP Committee, Health, Education, Labor, and Maria Cantwell, pensions, sorry. Maria Cantwell is also involved. She's a member of the Finance Committee in the Senate. So at some point, the bill with its price tag is going to go to her, and she will have a voice in it. So she's got no reason to say this isn't on her. So these are to let us know that if we're making arrangements to talk, this is why we want their time and why they deserve to speak to us as constituents. We'll talk about in a bit the best points the board here has thought were the good ones to raise. But I think in all these cases, we need to decide we're going to make an ongoing connection to these people, and we aren't going to go away. So a guideline would be the next time you talk to them in a conversation, not a lecture, but you're talking with them, make note of any excuses or confusions they pretend to have. And when you get back to them the next time, in a conversational manner, you say, now here's what I want to clear up because you had questions about this or you were confused about this. So we're here to help clarify it. Consider this the beginning in all of our work here, of course. This is the beginning of a long relationship. The National Board and PNHP Washington in their discussion this weekend have figured maybe 4 of the four of many good questions to bring up with members of Congress, Senate or House, is to discuss all the maybe hidden or all the ways that there's a public harm coming from Medicare Advantage, getting more and more healthcare funding out of the federal purse. Also, with the help of providers, all of us can get better understanding of the tricks that Medicare Advantage uses to always drop the sick and just keep the healthier and younger members. The third, so they're listed here, excuse me, listed here. And whenever somebody mentions the phrase about using the market approach, how much having a shop for a policy is just so confusing to most people, and that it's not a good approach to providing healthcare, of course. And finally, there's the issue, if you have information on how much money health and insurance groups are giving to members of Congress, you can formulate very well these questions about how does this help a member of Congress decide on what's good policy. And in all of this, by picking the issues they were talking about, it's a reminder that anything that strengthens traditional Medicare, even if it's not Pramilla's bill this year, and weakens Medicare Advantage, is a good. So these points will come up again.
How is there anything that is doing that? Is there any proposals about that? Weakening Medicare Advantage?
Well, the assumption is that as we talk to our members of Congress, as they're drafting these four new proposals, that we keep asking them, don't fund this money to the insurance companies. Use this money for expanding, strengthening traditional Medicare. So presumably all the lobbyists are working on them from one angle, and we're working on them from the other angle. And the more we can explain how Medicare Advantage is hurting so many people, we hope some of our members of Congress will listen to us. Yes. Well, so this list is another fact list. David will have these all on the web in the future, but we wanted to show which members of Congress are on healthcare committees. And we've listed here the committees they're on. The committees, and you'll notice Adam Smith, who is for both Pramilla's bill and Ro Khanna's bill down there on Congressional District number 9. He's not even on a healthcare committee, but is a chair of a very important House Armed Services Committee. But this is for us to go thank him when we're talking to him, particularly people who live in his district, to thank him for the support he's given when he's not even necessarily a member of one of these committees. Hopefully he's responding to his constituents, and that's why he signed on. So all the others are subcommittees or committees on healthcare, and they all have a reason to listen to you as a constituent. So you see, whether we're in southwestern Washington or in the Olympic Peninsula or in the strange 8th district that is both sides of the mountain. I think this includes Wenatchee, doesn't it?
Yes.
Yeah. Craig would know better than I, but I believe it goes all the way over to Wenatchee. So all of us as constituents in these groups have a reason to talk to them, and we can talk knowledgeably about. Each of these committees has a chance to tweak the provisions that are shaped in the bills for either adding more vision, dental, things like that, or capping out-of-pocket expenses. All of them have a voice in shaping each of those provisions. And all of them, if we talk about don't put more money into Medicare Advantage, strengthen traditional Medicare, this is our pitch for the next, this is the 117th Congress, I believe. So that goes on for another 18 months. So as long as this bill is being discussed, our pitch is to strengthen traditional Medicare and don't put more money that you're now designing into Medicare Advantage? Well, let's see. So these are the representatives. Next slide. The same 4 topics and others that you think of. This is the harms of Medicare Advantage, the way they will drop people who are get too sick, then they'll try to put them out of Advantage and put them into Medicaid or traditional Medicare and get rid of the risk. The dangers of making people shop for one of 20 different healthcare policies. I mean, a lot of us in PNHP know these points, but these are the ways they're trying to formulate arguments for this
You know,
coming
these,
up.
these Medicare Advantage plans have a way of gaming the system. Even the people that they have enrolled, they try to minimize the number of visits they have, the number of tests they are subjected to, and also they have this way of gaming the system where they try to find that the patient has more risk. They get paid more if the patient has a riskier profile, some of which is like can be completely irrelevant to whatever reason they came for the visit.
Yeah. All those examples, Mindy, are very valuable just in case any of our members of Congress pretend like they don't know. Thank you.
We're
So-
gonna
Go ahead.
go around these slides again, right? And then we'll have a full discussion on whatever's on these slides.
As you choose, right.
Let's hold our questions until Chuck is through.
Okay,
Well, our last slide is for those who, while we're waiting for Congress to do something helpful, ways of getting involved and working with the community. So there's a lot of community groups out there that are very active now, working with period. So looking for any allied community groups that you may be connected with, particularly youth we've seen in the last year and a half, 2 years, on the streets constantly. So if you've got connections or know people who know people in any of these groups led by younger folk, very valuable to get connected to them. Also, we want to involve any local communities that we come up with that should be interested. We want to get to them at the outset and invite them to join with us as we start to plan, and not to just invite them at the end. Oh, the event's going to be soon, come join. Well, no, we need to have them helping us plan how it would work. It works better. A fourth thing that came up was identifying who you know are important community leaders, however you define that, for again, working with in the future from the beginning of any ideas or events that we think of. And finally, for those who love to write and are good writers, composing what used to be called letters to the editors or op-ed pieces. Now there's so many other kinds of media that it's not just the local newspaper, but as you collect information you want to use in speaking, all that ammunition will make a great op-ed piece. So consider doing that. And in all these cases, keep in contact with PNHP Washington. Let PNHP know what you're up to, what you're proposing to do, who you're talking to. There may be neighbors near you that are interested in doing the exact same things who are our members. And so let us, let's be in touch with each other. And that's way we can build coalitions. I think with that, we've gone through, thank you for your patience. We've gone through the 6 slides, and I'm glad to leave it to David and Sherry to answer questions on steps forward. Thank you.
Well, we thought we might spin through those slides again, and if people want to pick up something that's on the slide, we can, develop a discussion from there. And if things go off into the weeds, we'll try to rein it back. But there's a whole lot of stuff there. And then
There is.
at the end, that last slide talks about what, other groups that are working for Medicare for All that we have basically not been in contact with, or they're new, like the one putting together this march for Medicare for All on Saturday, which is happening in 50 cities across the country. And this was put together by people that, most of the usual old folks, single payer organizations have not coalesced with and not formed collaborations with. But we'll get to that. And I have some, I'm on the organizing committee for that for Saturday, so I can go into more detail there. But I'm going to show these slides again, and we can whip through them if we want to. But okay, so you heard what Chuck had to say about this first slide. I think there's about 5 or 6 slides here. Let's talk about the update on the American Families Plan now. This is one of the 2 bills that it sounds like Biden would sign if it was presented to him. He's got this other, quote, bipartisan thing that's for infrastructure, which sounds like it's heading for some choppy water, but it's got a much better chance of going through Congress without reconciliation or a filibuster. But so this is the second one that Biden or the Democrats, progressive Democrats, are trying to pass, which I think was a $3.5 trillion. And this is just this stuff on Medicare is a part of it. One of the aspects, or one of the points of the bill that's going to have a hard time, and it's not going to pass unless we get rid of the filibuster, or they figure out some way to keep the 50 Democrats together, and Manchin, might be one who doesn't vote for this. But anyway, this is changes to Medicare that I think Biden would say he'd sign the bill. First of all, the drug price negotiations for Medicare, which would free up a whole lot of money that would allow for expansion of the benefits of the original Medicare plan, dental, hearing, and vision, adding out-of-pocket caps to original Medicare. And this last one here, reducing the eligibility, is probably the least likely of these other things to be included in the final bill, but it might be. So
they're saying 60, not 55 or 50?
Well, who knows what, if this goes into hearings, there's going to be people saying, well, 60, 62, some will say 50, 55. But this is what is out there now in I think the plan that the House passed. And I think they have passed this, but getting it through the Senate is a big problem. But I think the key thing here is Medicare Advantage. Every month gets a larger percentage of seniors in the Medicare plan. So we've got to do something to derail the Medicare Advantage, because they've got this, they've got all kinds of horrible things, and we could do 2 or 3 monthly meetings on Medicare disadvantage, and how they mess up people with their restricted panels, and over, upgrading, upcoding, and blah, blah, blah. But anyway, they have dental, hearing, and vision, and drugs. So we need to do something to bring that possibility into traditional Medicare. And if we did, with all the other advantages traditional Medicare has, I think we could really, knock the legs out from underneath Medicare Advantage.
I have a question about this Medicare Advantage. Is there any my understanding is that they get some sort of subsidies in addition to whatever they're upcoding and cherry picking, that they get some sort of subsidies. Is there anything about stopping that or curtailing it, or?
Well, they had a good deal going for them in that originally, way back when, there was a brief period of time where private insurers could sign up Medicare folks, but they refused to do it because they couldn't make money on it. And so the government had to offer them a higher subsidy than the expected expenses in traditional Medicare. So they get an enhanced bonus when anybody signs up. They don't just get that person's Medicare enrollment fee, they get extra. You know, when you sign up for Part B, they get extra, and they want to keep it that way. Thank you very much. And they use some of that to dangle gym memberships and the like in front of the newly 65s.
Yeah, so is there anybody that's in Congress that's maybe trying to stop that benefit that they get?
Not directly, no.
No.
They don't want to touch that because, and of course, the private insurers are right there to whisper in their ears about not harming the private insurers. So what's needed to be done instead is to improve traditional Medicare. Now, actually, David said that the Medicare Advantage covers dental, vision, hearing, as well as the 20% co-insurance. And those plans have pharmacy benefit managers that reduce the, supposedly reduce the pharmaceutical costs. I'm not sure that they do cover all of that. They may.
I believe they do, and that's why people enroll, is because they have all those wraparound benefits. And that's why I'm thinking if they only are able to provide that because they get some kind of subsidy, why don't we get rid of that subsidy? I mean, why subsidize these people? They're making like trillions of dollars in profits.
That's right, but trying to tackle it to take it away from them is hard. It's better to try to improve traditional Medicare so it can compete. Because traditional Medicare doesn't limit you in your choice of provider. And
right.
It also doesn't provide all kinds of restrictions when you start to get sick.
Right.
Of limited panels of who you're allowed to see, etc., which generally is what they make life miserable for the Medicare Advantage people when they get sick, and then they drop Medicare Advantage and go back into traditional Medicare. And then they are really hurt because when you do that, you no longer can buy Medigap insurance, which is needed to fit with all the holes that are in Medicare.
I think one of the things is a lot of these treatments have to be pre-approved, and these Medicare Advantage plans almost reflexively disallow them. So you got to jump through hoops to get it approved. But I think I saw a study that showed that 80% of the time they disallow the first treatment request. But if you persist, I think almost all of them, like 90% of them, are allowed. But statistically, only about 1% of people who are disallowed fight through it. So Medicare.
Well, yeah, they have to get their providers to fight through.
Right.
That's always, something they want to do. And especially, I did a locums at a Cigna insurance company owned clinic. When I first closed my practice, I did this locums at this place, and I did not realize what was going on because I had I didn't realize about Medicare Advantage. And it was just appalling. I mean, they wouldn't go to bat for anybody. I had patients that would come in with diabetes who they would like out of control, but they hadn't been in for a year. But like I would say, like, why didn't you come in sooner to get your check in? And, oh, well, I'm feeling fine. Nobody told me to come in. I mean, it was just horrific.
Many of you, this is Hugh, many of you may not have people a little younger. My wife just turned 65, and I have a lot of friends who are turning 65. Typically, in the year leading up to your 65th birthday, you will receive 2 to 3 mailings from different Medicare Advantage plans and phone calls and everything. They just bombard people with their information. And the other thing is, on your monthly cost, right? Everybody's got to pay into Medicare dependent on a sliding scale based on your income. All the Medicare Advantage plans are cheaper out of your pocket typically than what you have to pay for straight Medicare. But people don't understand that, you know, if you get cancer or you get really sick, etc., you know, the downside, and as David mentioned, getting out of them and back into traditional Medicare is problematic. And then you can't get a supplemental plan. And although Medicare, of course, doesn't itself restrict you to the physicians you can see and the providers you can see, a lot of providers don't take straight Medicare. They look at that straight Medicare as just like Medicaid. And for whatever reason, they'll say, well, you're out of network or whatever. So it's really problematic. I was last 3 years, 4 years have been on lobbying efforts from the American College of Surgery. And this year they had a concerted effort to encourage our senators and representatives to not support Medicare Advantage, because for surgical procedures, at least, their statistics said that across the board, they would deny at least 30% of all surgical procedures on the first pass. And, you know, which adds a lot of administrative time and effort and cost. And so even a conservative group like the American College of Surgeons is after Congress to get rid of these Medicare Advantage plans. And it's just a buyout for the insurance companies, you know, due to their lobbying efforts.
A buyout? What does that mean?
Well, you know, it was a Benny that the government gave commercial insurers to do that, you know, to have these Medicare Advantage, because the proposed savings that they would create for the government by all these denials and paring down, paying out benefits. The other thing that really floored me, I was listening to Tom Hartman the other day, who allegedly is one of the big voices of the progressive movement. He's sponsored by AARP, which of course is underwritten by United Healthcare, one of the biggest purveyors of Medicare Advantage plans. I got to write them back and bring that to their attention.
Didn't United Healthcare just take over the polyclinic? I believe so.
Is that right?
Yep.
Wouldn't surprise me.
Yep.
The other
Well, we'll see how that goes. I'll report next time I need to go in. My primary care physician is in the polyclinic, and I'm on traditional Medicare. I am not on Medicare Advantage. We'll see if that makes any difference.
The other thing is Medicare Advantage gets capitated money from the federal government based on
Right.
the, you know, the disease load of the patients. So that's a reason to bump up their acuity and upcode them.
Absolutely. Yeah.
But let's see, the other thing that's capitated, they get a certain amount of money. So that means that if they spend less, there's a reason to spend less, to deny treatment, because they get more of that capitated part that they didn't use. and they don't want to spend more because that'll come off their bottom line for their executives and their investors.
Yeah, and this is Betty. Yeah, I was reading something a while ago about that. I mean, it was interesting because they kind of the writer characterized the relationship between these insurance companies offering advantage plans as basically being handed a fistful of billions and by our government, meaning our tax money. And so, as David just said, it's in their interest to deny claims because they get to keep the money. So apparently there was some complaints about that, and these advantage plans were supposed to be audited by the government, and it never happened. It just never happened. And I think, the question, I'm sure, in everybody's mind, and is that why is this allowed to happen? Why does the Congress and the Senate allow this to happen? So anytime that's the issue, I always look back to how much money are they getting from the industry? Because why would they do this otherwise, right? Well, interestingly enough, I heard last week that Jeff Merkley, who everybody knows they think is really a progressive guy, he's behind the Green New Deal. He is really active around the climate chaos. And someone asked him about Medicare Advantage, and he basically said it's one of the best things going for the American population. And that's Jeff Merkley. So
Oh my,
what I haven't done is check to see where he's getting his money in terms of the industry, because that's really the bottom line. That is why these people don't do anything on our behalf, around this issue of healthcare or anything else, because it's where the money is. Where is the money? Bottom line. And then the last thing I want to say is that I'm finding it really hard to talk to people, because I have friends who, and almost all of them are on advantage plans. I didn't know it for a while, but then when I started having conversations, I realized they're on advantage plans because the premiums are zero, and they get theoretically all of these, things we don't get on traditional Medicare. And I was trying to figure out how to talk to them, and most of them are not people who wouldn't be able to pay the premiums. But they see it as like, this is really cheap and this is great, and they don't ask any questions about it. So I really think what we need to do is to write a PNHP Washington. We need to write a white paper and really briefly describe what are these advantage plans, because people don't really understand it.
People don't understand basic Medicare. They don't,
That's
just
right.
the process of signing up for Medicare is horribly confusing and intentionally confusing to people, so that you'll sign up with some fee-for-service navigator to help, an advocate to help you negotiate through the process. I walked out of every Medicare retirement session more confused than I walked in.
oh my God. If you were confused, can you imagine?
It's incredible. And I think they do it intentionally.
Do you want more food?
I'm afraid I have to sign off. I just have a phone call from my daughter who I need to talk to. So one thing I would suggest, has there been any liaison development? David, you were saying that we're not really connected to other organizations, but PSARA would be a logical, do you know PSARA?
Oh, sure.
Yeah,
Sure.
and is there an opportunity there for joint work?
Yeah, they're part of Healthcare as a Human Right Washington right from the beginning, which we were critical in starting it, 15 years ago or whatever. So, we know lots of those people, and actually I'm a member of, everybody here a member?
Yeah.
I'm not. I need to be.
They do good work.
In fact, they did have a link to this meeting
Yeah,
Okay,
Oh, good.
They put together a Medicare Disadvantage seminar.
Oh, I
online.
didn't,
I'm afraid I have to sign out, so I'll see if I can join you, get back in when I'm done with this call.
Okay,
oh, but
Thank you.
Tom,
Tom.
nice to
Yeah,
see you.
hi,
Thank
Mindy.
you for coming.
Okay.
We live in the same neighborhood, but I haven't seen Tom for a long time. He was in Ethiopia doing healthcare.
Oh, my.
Yeah,
he was at Pike Market Clinic for like 20
yeah,
so also. So lots
right,
of us know him. He's a great guy.
yeah.
I'm hoping we can smuggle him back into doing more with PNHP.
Yeah,
Right.
Well, I'd like to say that I think that had an excellent idea. I think doing a white paper on Medicare Advantage, even using some of PSARA's information on what they call Medicare Disadvantage, I think it'd be an excellent step because it would give everybody ammunition when they go to talk to any member of Congress to say, "Well, do you even know this? Do you know that the audit never happened that was supposed to happen?" I think that's a brilliant path to take.
yeah. I mean, this Cigna clinic that I worked at was just, I mean, it was incredible. I did not know about Medicare Advantage at the time. This was like over 10 years ago. And they would go over every single visit to make sure, and you would have to like check off any condition that the patient had. You know, they could come in for their left toe, but you had to mention, you know, every possible underlying disease that they might have, whether you needed to address it or not. And they were just ruthless about it.
Well,
And if
many,
you ordered an extra lab test, oh my God.
many of them will make home visits to look around and see how they can upcode from what they find in a home visit. And those lab tests, if your BUN is slightly elevated, they'll get you down in pre-kidney failure.
Oh, yeah.
Oh, yeah.
Hospitals do the same thing. The last 5 years at Harborview, they had a whole army of nurses that would go through the chart and see how they could code. I mean, if your creatinine's up a tad, you know, you've got acute kidney injury, you know, it was amazing.
Meanwhile, if your vitamin D was like borderline low and you wanted to check it again, forget about it.
Amazing.
Well, it all convinces me that the sooner we get single payer and get rid of all this other crap, the better off we'll be.
Exactly.
Far too
Right.
complicated for seniors.
Well, I don't know. The path forward seems really difficult. I don't know if anybody knows what kind of strategy there is nationally for a national PNHP. I seem to, when I was on that webinar with whoever was organizing that Medicare March, I forgot the guy's name.
Oh, Andre Stackhouse.
Yes. He seemed to imply, or somebody implied, that there was some kind of like, okay, hold off and don't push for this or that, the real thing, but because maybe there's a different strategy nationally. Does anybody can speak to that?
Well, I know Andre pretty well since I'm on the organizing committee, and he's the lead in Seattle for Medicare for All marches across the country. So I don't know if we want to get into that whole thing about the march, but it's worth, you know, at least 5 or 10 minutes talking about it and all the groups involved there and where they came from and so on.
Well, no, I'm just wondering if he seemed to imply that there was a national PNHP strategy that was not pushing for really everything we want, but something some kind of like compromise of something or other. I mean, I'm not sure if I'm reading something into it that wasn't really there.
I don't think that's true, but there was a
Okay.
worry in the beginning that all this was coming from the force the vote people who were trying to say, let's force or, get all our representatives to lean on Nancy Pelosi to say, put Medicare for all on the floor and let people vote for it, and let's see who's going to vote for it and who isn't. So
Oh,
there are a lot of people who were against that kind of strategy, and a lot, I mean, many for it. But anyway,
oh,
maybe that's what you're thinking of.
maybe so. So
But-
where,
But being involved, being involved in several organizing meetings, I haven't seen that flavor pushed forward. It's basically Medicare for all, Pramilla's bill. That's,
okay,
that's the number one. If you look on the website, that's the number one piece of legislation right at the top. And I think that's going to play out on Saturday.
okay, great.
The American College of Physicians for the internal medicine group used to always have a little booth for Medicare, or no, for health care for all single payer. And I don't know why it hasn't happened recently, but a big group like that to push for this would be very, very helpful.
What to do while we're waiting for Congress to move ahead on Medicare for all, or at least the changes in Medicare that we talked about earlier that would be useful and would, help eliminate the advantages that Medicare Advantage has. So work with recently organized allied community groups on the importance of Medicare for all. There's a lot of community groups out there that I've seen that are involved in this Medicare for all march on Saturday that, I might have been aware of them, but was unaware of what kind of capabilities they have. Basically, they're younger people, 25 to 35. And we're mostly, our cohorts are mostly white people in 60 and above. So there's a lot of energy and a lot of sophistication on organizing with these groups. They got social media down pat. There's several apps that they can use for organizing that I wasn't even aware of, like Slack, or there's another one that starts with V that they're using. So I guess I can search around to show you the groups that have co-sponsored this march on Friday and I mean Saturday. And I think you'd probably be aware of about 50% of them and unaware of another 50%. So I think we need to engage with these people, let them know where we're at, and help each other in a movement of movements. So this is kind of point 2 here, recent. And I think that this Medicare for all thing got off to a slow start because it was started from more young grassroots people than the typical organizations like Healthcare Now, PNHP, Public Citizen, Puget Sound Advocates for Retirement Action. They were suspicious because they didn't know these people. But if you look at now who's sponsoring it, PNHP chapter in Illinois is co-sponsoring it, and the New York's Metro chapter just signed on. PNHP Washington, our chapter was one of the early ones. And if you look at the Illinois chapter, that's where Susan Rogers is, the president of PNHP, is located, as well as Claudia what's her name, who's been around,
Fagan,
yeah, who
Claudia Fagan.
co-founder of PNHP way back when, and is head of Cook County Hospital, and is, I think, the national organizer now. So I think there's a groundswell, and I think we're gonna, I've seen it in a lot of, locally, healthcare for All Washington just signed on as a co-sponsor, Backbone Campaign, us, Healthcare as a Human Right Washington as a sponsor. So there's a lot of people we can meet out there and get to know them and join together. So
Should we be trying to wear a white coat? Or is that just like a turnoff? Alienating?
No, I hadn't even thought of that, but it's possible. If we're carrying the PNHP sign, and I think myself and Dana and maybe Hugh have committed to carrying the PNHP sign, but there's also another thing. We've commissioned 50 signs that have a Medicare for All card on one side and the points of HR 1976, Pramilla's bill, on the other side, that are posters that we're going to be carrying along in the march. So I've got to go pick up those, and there's 50 of them. And it originally had us as the URL, but it morphed into Healthcare as a Human Right Washington, who's going to pick up a lot of the costs. So we need people to hopefully pass out these signs to people who want them and ask for a donation. And if they give a donation, then they get the wire thing that you can stick it, make a yard sign out of it. So I'm hoping that people on this call will be out there Saturday and join in and help out with PNHP Washington's presence, and also these signs, which we're going to pass out to anybody who wants them, basically.
So we're gonna find each other, okay?
Yeah, I think it starts at Westlake. Usually it's
Yeah,
easy to find people at Westlake.
okay.
I think there'll be a lot of milling around at the beginning at Westlake, and that's an opportunity to find people. And I think they'll be doing some speeches there before the march actually starts.
It's going to start with land acknowledgement, and then Pramilla's got something she's going to read. We're going to, it's an audio that we're going to play. She can't be there. And then Joe Martin from Pike Market Clinic, Gina Owens from Washington Community Action Network, Hugh Foy from PNHP. There's going to be about, I'd say about 12 to at least 12 speakers, and some of them will speak. Fewer will speak at Westlake, and most of them at the Mural Amphitheater which is at the end of the march at Seattle Center. Jim Page is going to sing. Bob Wickline, probably most of us know him. He's going to be involved also.
Oh, yay, I like him.
Yeah, nice guy.
Hey
Well,
guys,
great-
maybe
He's got
you
great,
can use a compass point, like wherever the stage is set up and the speaker will be at the podium, then choose that, you're gonna go on the north side of that or the east side of that, south or something, or a department store down there. Isn't there a store down there? Like across the street, there's that little plaza. And anyway, just an idea. So that
Now, I think
you know
many
what
of us-
direction.
many of us were involved in previous Medicare for All marches, which were really, really impressive. I just hope that this one can live up to that somehow. Remember the one we went from the King Dome to Pike Market? We must have had many hundreds of people there with singers and dancers and costumes. It was really great.
well, what's the prognosis
For
for Medicare for all, or improvement in Medicare, or disimprovement and disadvantage of Medicare, Medicare advantage, disadvantage. It's-
I talk to a lot of people. I talk to every stranger I'm standing in line with. I talk to every clerk I cross on the telephone about it. And out of, you know, 40, 30, 45 people, how many I talk to, one, maybe two will walk away, but they have no argument against it. But, you know, most of the people I talk to want to hear more about it. They follow it and they nod, and some say, yes, I support it. I'm getting more, yes, I support it, rather than this is new information. They're getting it. That's my
But is that,
observation.
but does that, how does that translate into policy?
Well, I think if you look back, when they were putting the Affordable Care Act together, they wouldn't even invite any single payer people to the
I
table for
remember.
discussion.
Oh, yeah, that was horrific.
You know, and so now we have a bill, we have 112 at least co-sponsors in the House of Representatives. And so I think we made amazing progress. And I think no one knows what the financial impact of the pandemic is going to be on individuals yet. But just today, an article came out in JAMA that said that the American public is currently $143 billion
Oh,
in
yes,
debt
I saw
to
that.
collection agencies. And that's not even including the debt that hasn't been sent to collection yet. And that data closed before the pandemic started.
Oh,
So it's got to be enormous. Ryan Paget was the ER doc at Evergreen that got COVID early, and he got sent to Swedish and was on ECMO on bypass for 6 days. His bill was over $2 million.
Oh, God.
And I've been trying to get a hold of Ryan through some contacts. When one of Dave Baker, who's one of his colleagues, who's a hospitalist out there that I know really well, those guys finally had Ryan put it on Facebook with that figure.
wow.
So nobody, I think, has yet to see what the financial impact of COVID illness is going to be on people as an aggregate. But you can use those statistics now when you talk to people and tell them that, before the pandemic, we had the ACA still had, what was it, something like, there's still over 30 million people who are underinsured or are uninsured. And with all of the loss of jobs, which is what, 26 million jobs that were lost. I mean, it's got to be even worse. A lot of those jobs that were lost, of course, are in the entertainment and service sector, and those people didn't have health benefits, right? Your average waiter and waitress and cook, they don't get health benefits as part of their employment. So it's enormous, and I don't even think we have an inkling of how massive the financial impact of the pandemic is going to be on people.
Mm. Well, that's very good thinking.
And David, I sent you that article,
suggested-
that PDF from JAMA today, and maybe you could put a link to that on our website, because otherwise you can't get it for free unless you've got a connection through, UW Libraries or somebody. But it's pretty impressive data, and there's some good graphs in there too.
I suggested my neighbors call Kim Schreier and do a congressional inquiry, after they found out that their insurance company had the option of not covering COVID. And so if the insurance company had covered it, and the insurance company would have to go to the feds to get the COVID reimbursement. But because they opted not to cover it, this sick person has to go to the feds and get compensation for his hospital bill. So what I'm going to do is call Kim Schreier and say, what is the agency that my neighbors go to get to make an application, because when they call the numbers, they said, yeah, we're sorry. But anyway, so I'm going to call and see if I can find out what is the agency people can apply to get compensated for their costs of COVID.
But we really need to
Because I
keep the
hear it
pressure up.
again and again. That's going to cover everything.
Yeah, we need
Thank
to
you.
keep the pressure on Kim Schreier. I mean, she herself is a diabetic. She's a private practice pediatrician for Issaquah, so she's not in the most progressive district, and they gerrymandered her to include all the Central Washington people too. So she walks this fine line with all of that contingent. But I think for her as a physician, not to get behind single payer, it just makes me crazy. And you know, she's otherwise pretty good. I mean, for the American College of Surgery, she shows up for our stuff, but she won't commit herself to any progressive movement yet.
I got a question about redistricting. When is this redistricting supposed to happen? Are we supposed to be losing a representative?
No, we're not losing one. We just didn't get enough to get another one.
Oh,
Our population is not going down. And I think we have a what we have is a bipartisan commission that I think is 3 and 3. And I don't know what they do if they're deadlocked, but they're supposed to try to work it out in a neutral fashion in our state. So we're among the better ones of the states. But I don't know where the process is right now. Chuck, do you know?
No, I was going to respond to an earlier question.
Oh, go ahead.
Well, she was talking about Kim Schreier, and Margaret was asking, and Craig has been nodding his head because he's over in Wenatchee. He's on the other end of the axis of her district. So I think if Craig has got any insight into what makes her tick or how to talk to her, do you see her in Wenatchee very much, or do you guys have a connection?
She sometimes makes appearances, and I've been invited because I'm a contributor to some of her gatherings online. So I will pursue this.
That's cool.
I saw her talk to Indivisible, and she commented, oh, there's so many people out there who haven't enrolled for ACA. They don't know there's free help for them. And you know, I called her office promptly and said, you know, the ACA isn't free. You know, what kind of, you know, how can she say, you know, oh, free medical? You know, no, it's not free anyway. So yeah, you were there, David, weren't you? With Indivisible in Kim Schreier?
I was, I think I was on supposedly a meeting, but had one of her staff do it. But it's been a while, I can't remember exactly.
Yeah, I think it was Indivisible. No, it was that other person. Anyway, whatever. Yeah, thank you guys. But I'm going to call and ask on behalf of my neighbors, what is the agency that they can apply to so that they can ask her to do a congressional inquiry about them getting compensated for hospital stay. Mom and dad too. People.
Okay, Henry, your turn.
Well, I was saying, going back to what was said earlier, most of the people that I talk to are ready to support single payer Medicare for all. It's not a problem in the population, but we've got to get those doggone congressmen to buckle down and get this done. You know, there's enough reason to convince them. And I think that the details can be worked out so that it is feasible now. We don't have to wait any longer.
I can shed just a tiny bit of light on it. I mean, first of all, we all know that the medical industrial complex plus the insurance industry dumps tons of money on key people in Congress. Among them, Patty Murray, who I think gets over $1 million from in campaign donations from these guys. And that does have an effect on her willingness to kick them in the teeth, so to speak, by passing Medicare for all. But there's another factor.
You should publicize that.
Oh, okay. One of the things I think we could do as a project is going, I think you can find out some of these things, at least in Washington State. They all have to file with the public disclosure folks in Olympia. And so they have to reveal how much money they're getting and from whom. But there is another factor, and this I know because my husband is a federal employee as a retired federal judge. And I can tell you that the insurance that we get through the Federal Employees Health Benefits Program is top notch. We'll just put it that way. We pay a fair amount, but it comes out of his pension and our social, and of course, Medicare comes out of our Social Security, and the extra, the Medigap that they sell through the Federal Employees Health Benefits Plan fits in with Medicare like a glove. It's just wonderful. As a result, the only things left over for us to pay are vision care and hearing aids. We don't have to worry, and some exorbitant or overpriced anyway, prescription medications. But the result of it, this is the same program that all of the members of Congress are on.
Right, and it is, I know, I have a friend who's on this, retired from the federal government, and, you know, she's got this like fabulous benefits, and she, you know, she's just like sitting happy with her benefits.
Right, and she doesn't have to deal with Medicare Advantage. She can do just fine with Medicare plus their, they have a federal Blue Cross Blue Shield basic plus one.
Yeah, that's right.
Oh, plus one. It's perfectly designed for a retired couple. And
I'm gonna have to say goodbye. It's 8:30 and I have to go.
Oh, thank you so much.
Thanks,
Thank
Chuck.
Thank you so much, Chuck.
Thank
See
you.
you all soon.
Thank you.
Bye.
Okay.
Okay.
That was beautiful presentation. Clean, concise. That was
Yes.
good.
Yeah.
I've added
Anyway,
this
I
little,
could go on
yeah.
forever about the benefits of the federal program, but let me just say there isn't anybody in the United States that gets a better deal.
Yeah.
I add this little fishtail now when I have somebody's ear. I said, why should somebody who makes a decent wage pay premiums for healthcare for themselves and their family, and their employer subsidizes healthcare for them and their families, and they pay taxes to provide healthcare to those who don't pay taxes, and they pay taxes to provide healthcare to public employees, including the lawmakers. Why can't they just pay taxes and get healthcare? And it's just new information for them that they're paying for everybody. Anyway, so, you know, I'm experimenting with ways to say it.
Well, I think it's just very difficult to get members of Congress excited over the issue because it does not pinch them.
Right.
But that's a poor excuse because they're serving us. And I think we really have to embarrass them and make them look into this a little better.
I've actually tried to do that when I've been talking. You usually don't get to go face to face with one of them, but I know I've talked to Patty Murray's staff member and mentioned the enormous campaign contribution, and the staffer simply ignores the comment.
But you
Well,
know, Camilla Diapol has been a godsend. She's very easy to approach and she listens to you. And I think she's going to be a real leader in this.
Right.
Well, that said, they wouldn't force a vote, though. You know, they won't bring Medicare for All up on the floor of the House and force a vote because they don't want to show their cards. You know,
Right, and they also don't, yeah, they don't want to do that, and they also, I'm not sure what effect it has if they have forced the vote and it loses.
well, at least people know where people stand, but they don't want that to be public knowledge one way or the other, you know, which is unfortunate. I mean, the fact that there's just so much money involved on the table, and you know, every time you get a notice on the email, all I want you to do is give them money. It's like pay to play politics. This is insane, but that's the way it works.
If we had term limits, we wouldn't have this ballroom dance between Schumer and McConnell, between Biden and McConnell, between Biden and Schumer. It's just they're in that little bubble, and it's we need term limits also.
I just wanted to show you, this is the back of that sign that we're getting printed up and we'll have to distribute on Saturday. Let's see. Here's the other side of it. These are the ones.
Really cool. We did
Yeah,
that.
that's nice.
That's nice.
Backbone campaign put them together, but those, we got 50 of them.
Yeah,
That's great.
Can I just ask
great.
who of people that are left here are going to be there on Saturday and might be able to help carrying a sign and so on?
I'll be there.
Me
Good.
too.
Two?
I can't go.
Sorry, Craig, I wish you would be willing to drive over the pass.
So I know some of you.
My wife broke her ankle 2 weeks ago, so she's requiring a caregiver right now.
Oh,
I think
I'm
that,
gonna-
Going anywhere.
well, that's an even better excuse than the one I have. I signed up for a pediatric bioethics conference that's doesn't get over until 2 o'clock in the afternoon on Saturday.
I know Betty will be on a plane and let's see. So we got,
Paul is in Buffalo right now, but he was planning to join a march over there.
Great.
I
Did you
think,
guys hear about that small town? Oh, go ahead, Henry.
I think Don Mitchell said he was going to come. So that's maybe 4, 5.
I'll be
Wish I
there.
could.
And Dana's going to be there.
Yeah, Dana said he'd be there.
He's got a thing going on tonight with his family.
Yeah.
I hope to be at Seattle Center.
Oh, good.
Great.
Okay.
Did you hear about that small town that canceled their March for All, Medicare March for All, because one of the heads of the Proud Boys posted that he would be there, implying that he would be a speaker. So they canceled it. But his response was, "My people want Medicare for All. It would help my people."
Ah,
But
well,
they,
we're gonna
they
help those
canceled
people.
it.
Yeah, I think that was one of
It
the,
will help those people.
that
We
was,
don't help them.
that was in
We want to,
Muncie,
Yeah.
and kind of
Muncie,
Where-
Indiana.
delayed
Wow.
other people jumping in
Huh.
for a while because they didn't know who was behind all this stuff.
Wait, where was that?
I think the Proud Boy thing was in Muncie, Indiana.
Huh.
Well, it is an issue that
we
should
want to, and we will
transcend
take care of each other.
political boundaries.
David,
That's
what
right.
time is the march supposed to arrive at Seattle Center?
Do you want me to put up the schedule?
Yeah.
Sure.
I'll see if I can find it, but I think it's basically gonna leave West Lake about 1:30, and it's supposed gonna take maybe an hour to get there. So let me search for it, the latest one here. Go ahead.
Depends on how many people are,
Yeah,
you know.
those Proud Boys could use a little mental health, you know, if they, I mean,
Yeah.
really, the whole community would evolve up if everybody had a dentist and an eye doctor.
Yeah.
Yeah. Proud to be an American.
So one possibility would be to show up at Seattle Center to be there for the end of it, which I might be able to do.
Okay.
Yes.
after my
If you log into your conference just on your phone, you could just bring it with you.
Oh, I'm not doing it on the phone.
Can you
Why
guys-
not? Why not? You can switch to the phone.
Oh, dear.
can you-
Okay.
Wow.
This isn't the really, there was some changes made to this one, but basically, Pramila, I was going to read it, but I think it's better if she does an audio and we can play it over the speaker. So she's supposed to get that to me in shortly. So,
Hmm.
and these people are speaker. Ashley Painter is working with the demonstration march that's happening at 4 o'clock at Westlake about the 11-year-old kid that died from not getting treated well with asthma. It's a kind of a Black Lives Matter thing. Rebecca Parson, Black Action Coalition, blah, blah, blah. Stephanie is running for Adam Smith. Hugh Foy, he's running for mayor.
Yeah.
Mayor, yeah, cool.
Joe
I'll
Martin,
vote.
Page,
Oh, darn, I voted for someone else.
Peter Oliver, Shama Sawan, Marilyn Chase is going to be there. Jason Call is running for Derek Kilmer's seat or something, I think.
Who's Marilyn Chase?
Oh, she's a former legislator. She's retired recently.
I see. Okay.
And she has been active with healthcare, with universal healthcare efforts in Washington State.
This guy,
Okay.
Bunchy Carter, is the leader of the Black Panthers. And he's the son of Bunchy Carter Sr., who was murdered by the cops down in LA in the early days of the Black Panthers.
Oh, wow. Huh.
Looks like a really good lineup. Have a good March. I'm going to be leaving now.
Okay, nice to see you.
Take care.
Take care, Craig.
Thanks for your work, guys, for taking leadership
thank you.
roles.
Thank you, everybody, for coming. Looks like people are starting to drop off.
Well, we'll see you guys on Saturday.
Great.
Maybe I'll manage to get
All right,
there
Mindy.
and greet you all when you arrive at it's the mural wall that's just on the downtown side of the big building, the Armory.
Wait, what are you saying? What?
There's a mural wall on the painting there, and there's there's a mural painted on a wall, and there's kind of a grassy
Amphitheater.
slope leading down to it, and there's a stage.
Wait, what are you talking about? I thought it was.
Center.
In Seattle Center, that's where it ends up, Mindy.
Okay.
At the mural amphitheater.
Okay. Oh,
Yeah,
It's supposed to be a sunny day too.
all
Yeah.
right.
80
All
degrees.
right.
Not too hot.
Wear your
Wish I
hat.
was there, but
So you
Bring
got
some water.
your 3 minutes ready, Hugh?
Yep.
Good. That thing that I saw you
Good.
up the other day is should be the basis of it, right?
Right.
You know, it's
Thank
such a
you, guys.
complex. it's so complicated on the one hand, explaining everything to people, all the ins and outs. And yet it's, in a way, it's like so simple, like why, I just remember this like 30 something or 20 something, two girls, two women walking out of the Sicko movie when it was auditioned here, and I think Michael Moore was here. And they walked out, they were talking to each other, and I said, wow, I didn't realize that healthcare was free in France. I mean, people just have, they've grown up with this like ridiculous hodgepodge system where everything is just so commodified that they don't even have a
Free
concept.
market.
What?
I just said the free market.
Yeah.
Yeah. Anyway, it's just really hard to explain to people what's wrong.
I talked to a young man and he was listening pretty good. And then he started on about the $15 for an hour minimum wage. And he said, I get my news every morning from Rush Limbaugh. And I said, oh, that's the reason, you're getting, this. And then I walked out and then I walked back and I go, Rush Limbaugh's dead. And he goes, he died? When did he die? So the radio here in Yakima is playing Rush Limbaugh every morning for him.
Oh, wow.
And that's where he's getting his news.
Ugh, what a vicious man.
Yeah.
Rest in peace.
All right.
Thank you guys. I'll let you go.
Yep.
Okay.
We got work to
Here,
do
everybody.
tomorrow.
And
Work
thank you for coming.
Never ends.
Okay, good night.
Yeah.
Good night.